Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. Welcome back, lovely listeners, and thank you for joining us for part 2 of this CBD podcast. I wanted to break up this topic into 2 parts because there was so much information and research to cover, and I know it can be overwhelming and a bit of a process overload. So thanks for coming back today and joining us. Last week we focused mainly on periodontal disease. Today, we will focus specifically on the endocannabinoid system and all the amazing, cool, systemic, and oral health benefits from CBD. Okay, here we go, switching gears. Let's talk about cannabis and the oral health benefits of it. I'm so excited about this topic today on the podcast. Let's get rocking on the CBD side of the discussion, lovely people. When the oral cavity is under attack by these gram-negative bacteria, which I had mentioned previously, the body initiates the immune inflammatory response by releasing these leukocytes, enzymes, and immune-mediated cells from the gingival sulcular fluid. And I know I mentioned that before, but here we are. We're tying this together.
These are some of the words that we were supposed to write down.
What was the bacteria again, Indi?
Gram-negative.
But what was the name of the one we needed to remember?
Oh, P. gingivalis.
You rock. You are listening.
You see, I wrote it down somewhere. I just couldn't find the piece of paper.
That was funny. Oh, you're making me laugh. Okay, so here we go. Everybody, what is cannabis and CBD? Well, I'm here to tell you. CBD is an identified compound derived from the cannabis sativa, or we call it Indian hemp, herbaceous plant that is native to Western and Central Asia. Cannabis sativa has amazing medicinal CBD-based pharmaceutical compositions, as well as natural resources for the industrial hemp it provides. Cannabis has been used in traditional Eastern medicine for thousands of years for several health-related issues, as I had said before, including oral and dental diseases.
So that's something new.
Right. Right, new for us.
That.
Right.
Well, new for me.
Right.
I didn't know that. I mean, that's very interesting.
Right. Cannabis has also been used to reduce and prevent oral inflammation, as well as a prevention for tooth decay. So they've been using this forever. The sativa plant contains over 400 compounds with over 80 biological active compounds that react with a system in the body called the endocannabinoid system.
That's a big word there.
Say that word, Indi.
I am not even going to try. But good luck to you and everyone else out there.
Thank you. So here we go. The endocannabinoid system, and you may hear me go back and forth calling it the ECS in case it gets a little long.
Make it easy, yeah.
Right. So the endocannabinoid system is a complex cell signaling system that was identified in the early 1990s by researchers exploring THC. So this system was discovered in the body
in 1990.
That wasn't that long ago. That was like 30 years ago. So think about that. So this whole system wasn't discovered until researchers were actually exploring THC.
Right. That's
so,
interesting.
I know. So CBD and THC are 2 of the most prominent cannabinoids found in the cannabis sativa plant. Both cannabis and hemp produce CBD and THC. Cannabis has a higher concentration of THC. Hemp has a higher concentration of CBD. So I'll say that again. Cannabis has a higher concentration of THC. Hemp has a higher concentration of CBD.
Well, I think, a lot of listeners should be familiar with this because of the fact, especially New York State, recently, we know that there has been a lot of companies that are starting to cultivate hemp
Right.
because of the fact that CBD is become so popular.
Right.
And you can find anything with CBD these days. I mean,
I agree.
there's products for your pets, there's products for yourself, for your hair, for your skin, for everything you can think of.
Mm-hmm.
I saw the other day there was a chapstick or a lip balm.
I was just going to say that. I was in the store yesterday.
CBD, yes.
I know. I was just going to say that. It's so funny that 'cause when you just said that, I was like, I was just going to say that. But
I know.
It's so
it's crazy.
cool. I know, but it's just
crazy.
like everything.
And you walk into a gas station nowadays. Even
It's everywhere.
You know, you used to find these in specific stores, and
Right.
it was. And I still like to go to a specific store that is focused on one product instead of buying something from a gas station.
Right.
You shouldn't buy anything from a gas station to begin with.
Not even a corn dog?
Yeah, that's
Or nachos?
sushi. That's what you should buy. That would be even better.
Steak.
Yeah, buy some sushi. That would be good.
God.
But anyway, I mean, you find it in a gas station, so it's become popular. It's
funny.
definitely become popular, and a lot of people, I believe, or I think, are familiar with the fact that cannabis is focused on THC and hemp is on CBD.
Right. So, like I said, both CBD and THC aid in the function of the endocannabinoid system. So the research that has been conducted on CBD-based pharmaceuticals has been very positive, evidence-based results. So evidence-based means, to me, when I research something, I make sure it's always evidence-based because I need that to back it up. It makes it relevant. Does that make sense?
Yes, absolutely.
Right.
And I think we should mention this for our listeners too.
Sure.
All the research that is done for all the podcasts that we do, there's evidence-based. So we're not...
Always.
This is not something that we made up, or this is
Right.
not something that I think it should be this way, and that's what we're talking about.
Right.
This is all backed by science.
This is all backed by science, and that's why some of our podcasts tend to be a little bit longer, because some information is just so deep. Sometimes it takes a little bit longer to address that. That's why, I think it's really important to, if you're interested in a topic, stick around and listen to it, because it's definitely worthwhile. We're all educating ourselves.
Exactly. I agree.
Researchers base their findings on the therapeutic properties of CBD metabolites and the implications these compounds have in relation to the endocannabinoid system that aid in the reduction of oral and dental diseases. I just want to say this before I address what exactly this endocannabinoid system is. I want to let you know that, again, the research that we did on this topic was not THC. This was specific CBD. So CBD has all the properties that will enhance your oral health. I have yet to hear anything on THC, so I'm definitely want to say that I'm not condoning, smoking cannabis. This is more so taking CBD oil or CBD-induced oral health products.
That's a good point. Absolutely.
Right.
And this comes back to the fact that what we just mentioned, that everything that we're talking about, there's done some research and is science-based.
Right.
And we haven't done a research on THC, so we're
Right.
not even going to touch that aspect of the conversation.
Right.
There might be in the future, we might have a THC podcast, but as of right now, let's focus on CBD.
Right. And I also try to research what I see is very relevant, in the news or in the world, or things that are going on, because I know that that's what people are talking about. That's what people are learning about. So why not bring even further awareness? Again, if I learn more at all about THC, of course I'll share it with you all. Of course I will. I mean, why not? It's what I love to do.
Yeah, we're bringing new topics, and
Right.
if it's interesting, we'll bring it onto the podcast.
Right. So again, today we're focusing more on CBD. Indi, do you want to know what this endocannabinoid system is in the body?
Sure. Let's learn more about it.
Cool. The endocannabinoid system plays a major role in central nervous system development. So that includes the synaptic plasticity, as well as endogenous, which means within the cell disruption, and environmental insults. meaning any kind of inflammation or oxidative stress impaired on the central nervous system. So the most abundant and important cannabinoid receptors in the endocannabinoid system are called C1 and C2 receptors. So Here's a cool thing. Your body also produces cannabinoids in this system. Cannabinoids, come from the cannabis sativa plant, but this endocannabinoid system also produces cannabinoids. Tell me that's not cool.
Yeah, that's cool. That's good to know.
So these two receptors, C1 receptors, they're mostly found in the central nervous system, okay? C2 receptors are mostly found in your peripheral nervous system. So the peripheral nervous system is every part of your nervous system that does not include the brain and the spine. Your central nervous system is what focuses more on the brain and the spine. So the C1 receptors are mostly found in the central nervous system. C2 receptors are mostly found in your peripheral nervous system. You with me?
I am definitely here.
The specific enzymes break down the endocannabinoids, C1 and C2, after their function has been utilized. So these endocannabinoids can bind to either C1 and C2 receptor sites, where they are assigned and needed in the body and serve their purpose and function as needed. So when endocannabinoids may bind to C1 receptors where there is, let's say, central nervous system pain and inflammation, C2 receptors will bind to where there's inflammation in the peripheral nervous system, your gut, your joints, autoimmune diseases, things like that, anything that has to do with outside of the brain. So C1 again focuses on the central nervous system, and C2 is more peripheral. So anywhere there's pain or disruption in the central nervous system, these C1 receptors will bind and help reduce the inflammation in those areas.
Okay.
That make sense?
It does make sense, and I think that's why there's so many products containing CBD, because
it can benefit the whole body.
Yes, exactly.
Right. So you're probably wondering why I'm getting so detailed. Well, it's important to understand this endocannabinoid system prior to understanding the benefits of the cannabis and the CBD compound the plant contains, and where its medicinal properties are important. The more researchers are finding out how the ECS system works, the more beneficial cannabis and CBD have been to their research. They are finding that CBD contributes to the function of the endocannabinoid system and enhances the systemic health benefits of the individual. So remember, the endocannabinoid system produces cannabinoids. People who ingest CBD-induced products, all they're doing is enhancing this endocannabinoid system's functions.
Right. No, that's great. And I think we will talk more about this, because that's where the role of a full spectrum CBD oil comes to play, right?
Right.
Okay, so how does then THC interact with your endocannabinoid system?
I'm just going to touch on it a little bit because I know we're going to focus more on CBD, but that's okay. Thanks for asking. It's a great question. So cannabis sativa, the plant, contains THC. So THC will bind mostly to the C1 receptors. And do you remember where I said those C1 receptors were predominantly?
Yes.
The central nervous system.
Central nervous system, right.
Right. So hear me out here. So the THC compound has psychoactive effects. We all know this. On the brain.
Right, the high part, right.
Right. And that's what creates that high. So THC will bind to these C1 receptors in the central nervous system. That's what creates the high feeling or the altered state. THC, this can alter the brain's function and delay systemic muscular and motor responses in the body. The systemic function that THC can provide in conjunction with the endocannabinoid system. Let's see, so the benefits, what I have found, and like I said, it's very minimal because we don't want to touch too much on THC, but again, it's more pertaining to the central nervous system. So if you have pain in the central nervous system areas, it's great for pain management. It's great for reduction of muscle spasms, glaucoma, insomnia. It'll increase your appetite. It can reduce nausea, and it can reduce anxiety. Those are what I found of the benefits of THC in conjunction with the C1 receptors binding to the THC in the central nervous system.
So now we talked about the benefits, or how does THC interact with the system. How about CBD? How does the system interact with CBD?
So without THC present, and it's just the CBD, so it doesn't contain the high effect. So I want everybody to know that CBD does not have that psychoactive altered state. We're talking about CBD, not THC. So okay. CBD does not contain that high effect, but it does contain all the medicinal properties that produce amazing pharmacological effects. CBD is the main non-psychoactive component of the cannabis sativa plant. CBD acts as a secondary contributor to the endocannabinoid system and aids in the body's function of the C1 and C2 receptors. So it increases the function of the endocannabinoid system, predominantly, though, in the peripheral nervous system, okay? So let me tell you some cool benefits with CBD systemically. It's great because it can prevent cell death of healthy cells, which is huge. Oh, wow. We want healthy cells.
Absolutely.
So this is where it aids in the endocannabinoid system if you're taking CBD-induced products. It can relieve pain, especially chronic pain, in the peripheral nervous system. It's a great anti-inflammatory, a great anti-anxiety, antidepressant. Another thing that I discovered, which was cool, is it can increase cerebral blood flow to the brain to prevent stroke.
No kidding.
Yeah, I thought that was really interesting.
That is very interesting. Yeah, that's really cool.
And it's a great muscle relaxant. You know, for those who have Parkinson's or epilepsy, you know, it's great to help kind of control and manage that a bit.
Yes, absolutely.
It has great anti-convulsive properties. Again, we're talking about people that have Parkinson's, MS, and epilepsy. So, you know, it's kind of great and kind of relax those muscles a bit so that they don't have as many tremors and triggers.
It sounds interesting and beneficial for individuals that are suffering from autoimmune diseases.
Yes. I think it's fantastic. And the one thing that I also wanted to really put a focal point on with this CBD is its antimicrobial effects. And again, antimicrobial, remember I told you all the bacteria that's in the mouth? So if you do ingest CBD-induced oral rinses or oral products, it's a great antimicrobial. So this is why I want to wind all that together.
Yeah, I think that's perfect because it's all coming together now.
Right. Winter is the time of year when the air is dry everywhere you go. Oh, and don't forget the colds, sinus issues, flu season, and COVID-19 too. These may all contribute to winter dry mouth. Combat your dry mouth with Lubricity. This amazing product contains hyaluronic acid, nature's lubricant to help alleviate dry mouth symptoms, and it is long-lasting. I've been using as directed 4 pumps 4 times per day to get me through these dry mouth months, and let me tell you, it works and I love it. It can be used for relief of acute and chronic dry mouth symptoms. Lubricity is also flavorless, colorless, and odorless. It's great. I recommend Lubricity Dry Mouth Spray to all of my patients who complain of dry mouth from medications, systemic health issues, and other issues. So if you or someone you know has dry mouth, give it a try. Today, our lovely listeners will receive 30% off of Lubricity Dry Mouth Spray with coupon code CBD30 at lubricityinnovations.com. That's CBD30 at lubricityinnovations.com. And you can find the link in the description below. Give it a try today.
We talked about the cool stuff that CBD does for your body. Now let's talk about the cool stuff that CBD does for the mouth.
Are you ready? I'm going to say something that I say pretty much in every podcast.
Yes.
Let's clear something up now, lovely listeners.
Let's do it.
Here we go. Your mouth is part of your body. Did you know that?
No, I didn't.
Oh my God. This is
I didn't. Is it?
Yes, because everybody thinks that their mouth is separate from their body. So the same amazing functions that CBD can provide to your body can also provide to your mouth. Cool, huh?
That's cool. That is cool, yes.
So your body's natural C2 receptors will enhance their function with the attachment of the CBD cannabinoids.
Okay.
So remember when I said that one of the main functions for C2 receptors is in immune cells?
Yes.
CBD-induced oral products, when attached to these C2 receptors, will enhance the anti-inflammatory response as well as increase the antimicrobial properties in the mouth. So it's a great anti-inflammatory, great antimicrobial.
That's good to know when it connects with periodontal disease.
Right, which is periodontal disease is what? It's a bacterial infection.
Absolutely.
It increases inflammation, right? So it's caused from foreign bacteria, which increases inflammation, and CBD reduces inflammation and the bacterial.
Yes,
so this is great.
Absolutely.
So researchers are discovering that there are C2 receptors within the epithelial cell lining of the tongue, mainly in the connective tissue of the tongue. So think about that. These C2 receptors are also in your mouth.
Yes, and one of the reasons when you're using oils, they tell you to put a drop or two and maintain it or keep it under your tongue.
For like a minute, right?
For about 15, 30 seconds.
Right.
And I think that's the whole reason, because the receptors on your tongue.
Sure. So also C2 receptors are in your salivary glands. So hear me out, okay? CBD-induced products can actually reduce the symptoms of dry mouth as well.
Oh, I didn't know that.
Yeah, so wherever there are C2 and C1 receptors and the induction of CBD's cannabinoids are expressed, there will be an increased function of the receptors. So just know that. So you know that they're in the tongue, right? And we also know that these C2 receptors are in your salivary glands. So if you're ingesting, again, CBD-induced oral products, it's just going to enhance those functions of those endocannabinoid receptors.
That's good to know.
Yeah, so
that's really good to know.
I know, right? So CBD will increase resistance from biofilm formation as well as decrease the colony formation of plaque and tartar. So this will naturally aid in reducing foreign microorganisms and prevent oral diseases such as gingivitis and periodontal disease. So you can actually use CBD oral rinses and oral products to actually be a form of prevention for
gingivitis and periodontal disease.
Right. So you could be proactive and use it, or you can use it if you do have an existing periodontal or gingivitis disease. When the oral cavity is under attack by these gram-negative bacteria, as I have mentioned, the body initiates the immune inflammatory response. Remember how I said they release those leukocytes, enzymes, and other immune-mediated cells from that gingival sulcular fluid? Do you remember that?
Yeah, yes, absolutely.
So the endocannabinoid system not only expresses C1 and C2 receptors in the tissue lining of the tongue and the salivary glands, but hear how we can really correlate it. C2 and C1 receptors are also expressed in the periodontal ligaments of the sulcular fluid. So the periodontal ligament, which is the ligament that surrounds the tooth and kind of holds it in place between the bone and the tooth, the periodontal ligament is what attaches the tooth to the gum tissue, and in that area of that sulcus is where those gram-negative bacteria, P. gingivalis, like to attach themselves.
That's the word we were writing down, everyone.
You remember. You are listening. I love this.
Yes.
So that's so cool. So recent research suggests that the endocannabinoid system plays a role in modulating the inflammatory response of periodontal ligament cells that have been invaded by P. gingivalis. So this will reduce the gram-negative bacteria that causes periodontal disease.
Okay.
So CBD injected into the sulcus, where the periodontal ligament cells reside, has been proven to be a very potent anti-inflammatory and antimicrobial agent by increasing the anti-inflammatory response of these C2 receptors. So these C2 receptors are on the tongue, salivary glands, as well as in the periodontal ligament. So go ahead.
Yeah. No, I was just going to say that's very interesting. That's really great. Yeah.
So people suffering from moderate to severe periodontal disease exhibit elevated levels of pro-inflammatory mediated cells in their blood. local periodontal treatment therapy with the induction of CBD-induced products will reduce these inflammatory markers systemically. That to me is huge. So if there's less inflammation in the mouth, then there's less inflammation to migrate to the rest of the body.
That's amazing.
I know, I live for this
That's
stuff.
amazing. And to think of the fact that we are just finding out of it.
I know. It's crazy. I mean, I wish I knew this years ago.
Yeah, this is something new, and
right.
we're just finding out now.
Right.
And we're in 2022.
Right. So also researchers have found that after treatment of periodontal surgery therapy, there is an increased number of C1 and C2 receptors in the gingival sulcular fluid. This means that with the presence of CBD-induced products in that site, there will be an increased anti-inflammatory response for the healing of the periodontium. So what's nice is dentists and dental hygienists can use CBD oral health products after periodontal treatment therapy. This means there will be an increased anti-inflammatory response for the healing of the periodontium. So this will significantly improve the state of periodontal disease within these individuals.
That's great. That's really good to know. And it's an additional tool, if you will.
Sure.
For dentists and hygienists.
Right, in conjunction.
Yes, absolutely.
I love that.
It's something additional to help maintain periodontal disease to the current state and not have it progress.
The most exciting thing for me when I was practicing was when I would get a patient that would come in that has not had their teeth cleaned in, let's say, 15, 20 years, which is crazy to me. And I see the state of their mouth. And I would put them on a periodontal therapy treatment plan. And they would be willing to come in, go through this treatment. And my biggest reward when I was practicing dental hygiene was to see the positive progression of their oral health.
That's great. Yeah.
Nothing makes me happier.
Well, of course, and because that's what you love doing.
Sure.
Right.
And I love seeing people. Right. And I love seeing people go from, not having awareness, not understanding, to listening, being receptive, doing all the proper things, and then them seeing the results for themselves. And I think that is fantastic.
It is. It really is. So all this research, and we mentioned this a couple of times, multiple times actually, but all this research it's very recent, right?
Sure. Oh, yeah. So this is super cool. So as of July 2021, there was recent studies that included over-the-counter oral antimicrobial rinses, prescription strength antimicrobial rinses, which were prescribed to patients. Remember that chlorhexidine one I had mentioned earlier? And oral rinses that contained less than 1% CBD infusion. So remember what I said, less than 1% CBD infusion.
That's crazy.
So the infused CBD oral rinse with less than 1% CBD induction had superior plaque reduction and accumulation in comparison to the chlorhexidine and the over-the-counter oral antimicrobial rinses.
That's very interesting.
And you know all about chlorhexidine, right?
Less than 1%.
That's huge.
That's huge.
Right.
That's crazy.
Yeah.
So I know that chlorhexidine has an extremely high antimicrobial content. Chlorhexidine is an antiseptic, disinfectant, and preservative that is effective against a wide range of bacteria, and also a broad spectrum antimicrobial agent that is active against aerobic and anaerobic bacteria.
Right. And remember how I said today we were focusing more on the anaerobic bacteria, which was those gram-negative,
absolutely.
The P. gingivalis, which are the ones that, increase the risk for periodontal disease. Yeah, like I said, Indi, you don't need me. You got this show under control. I'm out.
We might change the name of the show.
What are you going to call it?
Teeth Chatters with Indi. I got to put my name in it somehow.
So, yeah, Indi, you're right. It totally does that. It's awesome news to know that CBD-induced oral health products are way more effective in treating infections in the mouth. So why not use something that is safe, such as CBD, and that is natural and that works?
That's great
my
news.
Theory, right?
That's great news, and I think it's great news for dental professionals as well as anyone suffering from an oral health disease. there's promising research with evidence-based studies to prove that, CBD can improve oral health.
Right. And with an increase in research in CBD and all the oral health benefits it provides, the results are hopeful, and I feel as if they're very promising. So I've always been one of those dental hygienists that's tried to give all my patients a healthy and holistic alternative to oral health products. So that's why I'm so excited that there is new research to back that up. If we can significantly decrease the progression of oral health-related diseases in the safest and most effective way, then there is hope for the future that natural remedies used for thousands of years will come full circle. Getting back to our roots and utilizing natural resources for medicinal purposes works. And why change what's been consistently working, as well as being provided naturally by the earth? It's so lovely how effective it is, and I love how Western medicine is finally getting on board. So why not try it, right?
Absolutely.
I mean, what is there to lose? Since I began my research on this topic, I have now incorporated CBD into my daily regimen. I was using it, like I said, occasionally if I needed it for, sleep. But now I have to tell you, Indi, I take it habitually every morning.
Every morning?
Yes.
And are you doing the oils?
Yes.
You're doing the oils, yeah.
Every morning.
No, that's great.
Yep.
That's absolutely great.
And I have a feeling, too, you're going to keep using it as well.
I will. I'm not going to lie. I will. There's no reason for me not to.
Right.
There hasn't been anything negative about it.
Right.
So why not use it? And if it works, it works. It's working for me.
Right.
And not to say this will work for everyone else.
Right.
Some people will be very skeptic about it and
Right.
might not even try it. But maybe do your own research. Maybe look into it. You don't have to go full in and, start taking the oils and all the other products that's out there with CBD.
Right.
Try small or start small, or maybe talk to your doctor.
Sure.
And see what they think,
Right. And delve a little deeper and do a little bit more research on your own. But I do feel like we've covered so much today.
We have, absolutely. I think we did.
So I want to thank you guys so much for taking the time to listen to the podcast today. And Indi, thank you so much. You rock for being here again. You are a trooper.
Thank you. Thank you. It's fun being here. I really appreciate you having me here.
I know we have fun.
I think your content is always great.
Thank you.
It's beneficial for everyone.
Thanks.
I think everyone should listen to your podcast at least once.
Thanks. You're my biggest fan. I appreciate it. Yeah, because you're trying to take it over. No, I'm kidding.
Yes, exactly.
So, everybody, lovely listeners, if you like the podcast, please hit the like button and help me grow this podcast so that I can help you all expand your knowledge and mine in understanding on health-related issues and topics, as well as learn about what is new and relevant when it comes to oral and systemic health. My passion is to help people to become healthy and happy. The healthier we feel both physically and mentally, the more energy we have, not only for ourselves, but for everyone else. It makes us better human beings. So thank you so much for listening. And Indi, thank you again for being here today. You're the best.
Absolutely. Thank you. Hope you have a great weekend.
You too. Stay
warm.
warm.
It's exactly what I was going to say. Stay warm. It's going to be cold.